Hi, my name is Corinne Young. I'm a pulmonary nurse practitioner and the president and founder of the Association of Pulmonary Advanced Practice Providers, or APAPP. And today I'm talking to you about Nerandomilast. So Nerandomilast recently received approval for idiopathic pulmonary fibrosis. And we are going to be talking about dosing, side effects, dose adjustments for this therapy. During the trials, Nerandomilast was studied as monotherapy for IPF, and it was studied in combination with pirfenidone and with nintedanib. So this could be used by itself or in combination with one of the other current antifibrotics that we have. The current dose recommendation is 18 milligrams twice a day. It was studied at the 9 milligram twice a day dose and at the 18 milligram dose by itself and in combination with the other therapies. And what is currently recommended that if it's being used by itself, target dose is 18 milligrams twice a day if the patient can tolerate it. If it's in combination with nintedanib, 18 milligrams twice a day is what's indicated. However, if you need to dose adjust to 9 milligrams twice a day, you can because of side effect profile. If you're using it with pirfenidone, the recommendation is to use it at the 18 milligram dose twice a day or not at all. There was not really much efficacy seen at the 9 milligram twice a day dose in combination with pirfenidone. So just something to consider there. Also, it is a CYP3A substrate. So if we're going to be using it in combination with other CYP3A inhibitors, we may want to reduce that dose or just consider not using Nerandomilast in those cases. So you could use the lower dose 9 milligrams twice a day, with, again, the exception of using it with pirfenidone. Now, as far as side effects go, the most common side effect is diarrhea, which unfortunately we did see with the other antifibrotic therapies. However, there seemed to be less diarrhea side effect as monotherapy in Nerandomilast versus monotherapy of pirfenidone or nintedanib. If we are combining Nerandomilast with one of the other antifibrotics, then we may see more diarrhea in those cases. So just something to keep an eye out for. Usually high protein meals sandwiched with the medication usually does help reduce that. These patients can also have depression or mood changes because as a class effect of this therapy, so something to watch out for in those patients. Other GI symptoms like nausea, vomiting, weight loss, decreased appetite can happen, so we need to watch for that. We know our patients with IPF tend to have increased fatigue in general as a symptom of their disease. However, we did see crippling fatigue reports in, I believe it was the pirfenidone trial. So something to keep an eye out for if they're having more fatigue once they're on this medication. Headache and back pain were also reported during the trial. Dizziness was also reported. Big reactions, serious side effects that we want to watch out for are allergic reactions like hives and skin rashes, difficulty breathing, swellings of the lip, tongue, throat, that type of thing. There was no reports of anaphylaxis during the Nerandomilast trial, but allergic reactions unfortunately can happen. So something we do want to watch for. I hope you found that helpful in reviewing this medication, how to dose it, what side effects to look for, how to dose adjust. We hope to see you on another medication review.